Welcome to another edition of Reality Bites. I'm Dave Hinderleiter, here to help introduce you to the Southland community. We're in the great studios here downtown Orland Park, and this is just an exciting time. I have Aishling Kelly, my second time to have you with me, and I'm so excited to have you here today. You know, just a few weeks ago we did a great segment, I think, that talked a little bit about what you do for our community, and today I want to drill down just a little bit more, if you don't mind. Is that okay with you?
Yes, that would
Aishling?
be perfect. That's the whole idea of this show, right? To give out that information.
We do want people to know, and I think a few weeks ago we had the good senator with us talking about some good initiatives that are helping people that need the most help in their senior years, and not always their senior years. So I'm going to ask you, because you know, home is where the heart is.
Right.
And so we're going to talk about the differences in home care, home health care, home, because that's where the heart is. Right. So I'm going to ask you once again, for the crowd here in the Southland, to tell us the name of your company, where it's located, and then we're going to get into the nitty-gritty.
Okay.
Okay?
It's
Have at it, Aishling.
Aishling Home Care, which is home services, and I am located here in Orland Park, covering Cook, DuPage, and Whale counties. I'm a private duty home care company.
And I know we've talked about this a little bit, but when private duty home care, what does that mean to the lay person, the millennial that's trying to figure out what's going to happen with their parents down the road?
Well, private duty, they probably wouldn't even understand that word because that's nearly a word that's used amongst professionals that are in this arena. But private duty means that it's a private duty person coming to your home. So
they're a healthcare professional of some level.
They can be, but they don't have to be.
So what are some of the things that this helper would provide?
So they can be a CNA, which would be coded as that is a certified nursing assistant.
Thank you.
Which means that they have a little bit of a higher skill set. However, under the licensure of a CNA, she can't perform CNA duties in a private duty home. So if I was to hire a CNA, she may have the skills up here, but she can't operate those skills in the house because she's coming in under a home licensure license. So the scope of practice is quite basic. So back to your original question, what can we do? We can do anything that's not medical. And you might sit there and say, well, what can you do then if you can't do anything that's medical? This is where we need to show our audience the differences between home health and home care. Because home health is medical, home care is not and should not be. Right. So there's a huge difference.
So when I had an experience earlier in my life with an aged parent,
right,
and all of a sudden I noticed that things weren't being taken care of in the home. I was worried about the consumption of food. Did he have the right food in the house? Yes. So a home care helper could kind of go through that type of stuff and make sure that the right foods are in place.
Yes.
That the laundry is taken care of properly, that they're doing a certain amount of their own sanitation, so to speak. Yes. Not that this care person is doing it, but making sure that it gets done. Right. Is that correct?
Yes.
What about shopping?
We can do that too. So in that situation, just like you talked about with your dad and you shared on the last program, that is very classic of what we would do in the house. We are literally a personal assistant that are licensed, insured, bonded, screened, supervised, trained, drug tested, and continually educated. Wow. So that's what home service is. That's what I do. And yes, they can bathe, they can do all of the hygiene and the cleanliness, they can even do a little bit of housekeeping, oversee that they take their medicines. However, we are not allowed to set them up because we're not medical people.
Right.
Now, even if I was to place a CNA, which is a certified nursing assistant, in the home, she still can't set up the medicines. The family has to do that. Excuse
me for interrupting, but I remember getting the 1 week packet and every day all the pill boxes and stuff. And so that's what you mean by set up, putting the pills in the right spot so they take them morning, noon, and night.
So we're not even allowed to do that.
You cannot do that. I know, but that's such a challenge.
Yes.
Oftentimes, can one of your people observe and make sure that indeed those boxes have medications in them? I mean, is that a fine line, or help me understand that?
It is a fine line, and I'll tell you why. I'll tell you why. Because to a non-medical person, all white pills look the same. They might all be white oval, but they all are different type of pills for different type of illnesses. So dropping one on the floor or dropping two on the floor and picking one up and putting it in the box, that's just not something that we should do, because A, we're not licensed to do it, and B, we're not medical. So it's very hard to do a favor for somebody, because when you're willing to bend the rules once, then you're asked to do an additional favor and an additional favor.
Yeah.
However, this is what people don't understand about home care. I have resources to everybody. I have resources to the people that families need. So, for example, if we had a gentleman who has a guardian, just say he has no family and he has a guardian, that guardian doesn't want to have to take a day off to come home to fill a medicine box for the person they're guardian for, right? It makes sense. However, we still can't do that.
Right.
But there are people that have packages of medicine that the person can use, comes from Medicare, a little bit more expensive. I think it's $12 more per month, but everything comes sealed and already medicated per the time that they're supposed to take it, with the date on it. So in actual fact, that's the solution to this problem for all home care agencies, because some people will say, well, we can't afford care all the time because it's private pay. Okay, private duty, private pay, and we understand that. What we would see on our end, if we were to come in for our minimum, which would be 12 hours a week, we'll say on a Wednesday, and we come in at noon, and I say, David, did you take your medicine today? And you look at me straight in the eye and say, yes, Aishling, I did. Well, if you have...
I think I did.
Well, you think you did,
sure.
You're not
Maybe
sure?
I did.
Okay. So I could actually go back to this little package, this box that has all of your medicines pre-dispensed, and I can look and see 9 a.m. on Friday the 17th is still sitting in the box of 2017 and exactly what it's for. So I can say,
well, that's a big day, Friday the 17th.
I mentioned that because it's St. Patrick's Day. I just happen to know that. But I'm just saying that we can work with people like that can solve these problems.
Yes.
So I have, and most agencies have good resources available to families. There's always a solution to everybody's problem. If you find the right contact that can help you, we can do all of that stuff.
So, in general, you kind of oversee the general conditions of what's going on inside the home.
Yes. Yes.
While they can't medically treat them, you are there to observe and be the first line of defense when something is starting to look a little bit askew. Is that a fair assessment?
Yes, and let's go back a little bit. When you say we're the first line of defense, we're looking for hospitals to really take home care seriously as part of the continuum as care as people are aging, because as you know, the baby boomers, it's about
we're all
to explode.
aging if it goes right.
Yes, and currently there is a shortage of caregivers, and obviously heading into the year 2020, 2030, 2040, it's going to get worse. So we actually can help the hospitals keep people out of hospital, not to be hired when disaster has struck. That's too late for us. But when I say to you we're non-medical, our caregivers know their clients very well. So if you're servicing a family and you're coming in and you're helping them eat and you're helping oversee that they're going to the bathroom and they're actually having proper, bowel movements and they're eating right, they're taking their medicine, they're getting their exercise, caregivers know when they see a change in somebody. And although we're not medical, we can actually reach out to the family and say, well, there's a change in your mom. She's very forgetful today. It's come on all of a sudden. And usually we can tip the families off to abate a problem that might come down the pipe. Mm-hmm. Why? Because if somebody's very forgetful, we'll say all of a sudden, that means there's something going on. And we will alert the family, and the family might call the doctor and say, Mom's not the same. Yeah. She's talking boo-boo or gaga or something's off. Can we bring her in? And that would prevent her going into the hospital and sitting on a gurney for 24 hours until they figure out what are we going to do, until we figure out what's wrong.
Yeah, well, that's tremendous. So I don't want to get too much into the weeds on this, but I think it's important to understand because in my case, I provided a notebook. So do you do something like that? Do you put a record in for the family, or how does that work? I mean, what are good practices, best practices?
Well, in today's age, technology is huge. So we at Aishling Companion Home Care use telephony. And telephony is a system that our ladies clock in the house by phone, and they clock out by phone, but it's the client's phone. So we know that the caregiver is on site and in the home, which is very important. And then we
Very
put
cool.
together care plans, and that's all coded by numbers. So when the ladies or our gentlemen caregivers clock out, they put those codes in, and those codes relate to the activities that they did. So what am I here to do for your dad today? He has to have a shower, we got to make him lunch, prepare something for tomorrow, leave it in the refrigerator, and make sure he takes his medicines. 4 codes. We're making sure we see those 4 codes when the caregiver
Great.
clocks out.
Oh, that's awesome. That's awesome.
Now, if people don't have telephony, and some companies are smaller and, you know, they're building up their business and they don't have the funds to do that, you can do the book and you can write in the book.
It's kinda old
it's
school,
more
but-
legwork
Yeah.
Because you've got to go back and pick up the paperwork.
Yeah.
So it's a bit challenging.
So I put something back here on the wall because you were very intrigued, or you intrigued me. But many times you've referred to the caregivers as female. Mm-hmm. And then you just kind of corrected that
Right.
for a second.
Right.
The preponderance of your associates, are they female, would you say?
Yes.
And
Yes.
so now, for me, again, with my father, and that's the only experience I can really
Okay.
speak to, when I first introduced the concept to him, he's saying, why is this woman coming into my house? And so do you work, how do you make that initial assessment about the caregivers that are going to come into the home? Do you interview with the for lack of better words, with the patient, not patient, but with the individual? How do you do that? Because that's a tough job, I would think.
So we're either interviewing with the patient or the patient's spouse or the patient's son or the daughter. Usually that's who it
So
is.
there's a personal interview type
Yes,
of thing.
and I don't mean an interview for caregivers, it's an interview with the agency. So how can we help you? We come out and we do a free in-home consultation. And we'll spend an hour with you in the home where you can ask any question you want and we tell you how it all works, how we bill, how we hire, the whole entire process, and we talk about the care plan. So usually it is a family member, usually.
Yeah.
It's usually not the
If
client.
there is one.
Yes, if there is one, or their advocate. Very important. So that's a big piece of what we do because it's your chance to ask any questions of the agency. And you should be asking questions and you should be interviewing at least 2 to 3 agencies because we're not all the same.
Really?
Yeah.
Oh.
So when we started this conversation, you said home health and then you said home care. Do you think they're both the same?
Well, I know better than that. Because that's why I have you here.
Okay, but if I was just to say to you, home health agency, home care agency, home
Interchangeable
placement
in vernacular.
agency,
Yeah.
they all have
Interchangeable.
the word home and they all have the word agency, right?
Yeah.
So the consumer wouldn't know that I am completely different to home placement, and they also wouldn't know that I'm completely different to home health. 3 very different agencies. So home health is covered by Medicare. That's covered by Medicare for a certain amount of time in the home. And then home placement supplies caregivers like I do, only they are not the employer. So they place. So home placement is you're focusing in on that placement portion.
Right.
They don't follow the client's care in the home. They don't supervise the caregivers. And most importantly, they're not the employer of the caregiver. They're just a registry and placement. So that's completely different to me
Yes.
because everybody that works for me are my employees. And back to your question with the families, we will ask whether it's a male or female, would you prefer a male caregiver or would you feel more comfortable with a woman? And ironically, most women say women and most men say women. But some men will say, no, I'd like a male caregiver. So it depends.
Well, I think the age has a lot to do with that.
Yes.
In my case, who took care of my dad all those years? My mom did, So that was just a natural
Sure,
assimilation.
sure.
But I saw later on in the process where it wasn't so comfortable for strange women
Of course.
to be around. So
Right.
that's just what made me think about that. You always bring up all this stuff I think about.
That people don't think about.
Uh,
So when your dad was in where he was in, did he have male caregivers as well as female caregivers?
A few.
Okay.
A few. When he was in
A facility.
a facility, but at home,
Yes.
no, it was always a female.
Right.
But
Just
I
know
made,
that he could have a choice. You can have a choice. You can have
Yeah.
either or.
they had to be card players.
Oh, okay,
Yeah.
okay,
And I warned them all not to bet with him because he
Right.
would take all their money.
Right, right. I mean, it's really, with the good agency, when you come out and talk, everything has to work for everybody concerned. It's not just about the agency; it's about the family needs as well. And then it's about the caregiver, that you put the right match in there. And sometimes it takes maybe one change or two change to get the right personality, because
definitely.
not everybody gels on
Yeah,
that first
it's
week.
it's a chemistry.
It is, and it's a challenge too for families who have never had anybody come into their home, have somebody in their home. That's very frightening for them, and they're still a stranger to the person, although they're not strangers to us because we're their employer.
Right. So I think that's just so important
It
for
is.
people to understand it, and thank goodness, actually, you provide that type of quality care. That is just so important to, for people getting into this position for the very first time.
It's
You really
challenging.
don't have any background or training on what to do. So as we get ready to wrap up today's session, how would you recommend people go about finding resources that you provide and make those basic decisions? What are the couple, three things that you would put on your list of must do for those people that have to make those decisions?
Well, you should always check that the agency is licensed, and check what sort of agency it is. So you would go on to the IDPH, which is the Illinois Department of Public Health. If they're not on that list, they're not a licensed agency. So protect yourself
Licensed
that way.
agency, very important. Okay.
Then you need to look on the IDPH website when you find that licensure number and find out, are they placement or are they home services? Because one, you are the employer, and the other one is, I am the employer.
Okay.
So that's very important, that you want to make sure that when you're bringing somebody into your home, that whoever you're bringing in is insured and bonded
Most definitely.
and trained and supervised. It's very, very important. And as a consumer, you have the choice. You can go and pick a placement lady as well if you want to. And like I said, that's fine too, if that's what your option allows and that's what you can afford. But there's very clear differences. So ask those questions when you make that phone call. Ask the agency.
Well, it seems so simple.
It does.
But it's not, and
No,
I
it's
know
not.
that because
It's not.
your mind is going so many different directions, and this is not what you're prepared to do.
Yeah.
Oftentimes it comes like you say, you might show up at home one weekend and all of a sudden you see things are not
Yes.
quite right, and you say, boy, I better do something.
Right.
I would say plan ahead, meet a young lady like Aishling Kelly to get that job
Sure.
done, and
Sure.
prepare ahead of time. Plan
Just
ahead.
do your homework.
Yes.
Just do your homework.
So if someone wanted to know more about the services that you provide, Aishling, what would you say is the number one way to contact you?
They can contact us at the office at 708-361-7845 or our website, aishlingcare.com. Or simply Google home care in Orland Park and they'll see all the people that pop up. And
Awesome.
call all of the agencies and do your homework. Check it
Now,
out.
Could they also go to southlandtv.net and see a
Yes.
video like this so they could learn a little bit more about you?
Absolutely. And I'm not always in the office, every single day for hours on end. I'm out
That's
a lot. But we answer a lot of questions that people have, and we'd be happy to answer any questions that people have. If we can't help them, we never leave them sitting out there. We
Yeah.
always direct them to where they need to go.
Perfect. Well, thank you for giving your time
welcome.
today, because it was really, really important. I think after our last time together, I really wanted to clarify a few things.
Yes.
I wanted to make sure that the folks out here in the Southland really understand that they've got great options, we've got great resources, we got great people like you, Aishling Kelly, and we want to make sure that they take advantage of it
Sure.
before the duress sets in and they make decisions that they'll be unhappy with later on. So thank you for what you do again.
You're welcome.
It's so
Thanks for having
important
me.
to us all.
There are many ways to showcase your product and service, but if you focus on the effectiveness of the medium, video marketing is a wise decision. In fact, people these days are shifting from audio and text to video. And with social media making it easier for you to share and post the video, it's definitely a must-do marketing strategy. Southland TV knows that the goal in marketing is to gain brand recognition, so your company has to be remembered. We also got some numbers for you. People have been shown to remember 10% of what they hear, 20% of what they read, but 70% of what they see and hear. It's like no-brainer. Now, let's get you started on a standout video which we will produce. Southland TV is the first online video magazine of its kind for the South Suburbs. Call us at 708-289-0221 or visit our website for more details.